Hi everyone. This is the first time as new Chief Exec that I'm trying out this new technology. So what I'm really wanting to do is find an interactive way to chat to people. I want to give you the headlines of what's been going on for generally about the last 2 weeks. But really importantly, hear from you, what are the questions you want to ask, and get some feedback as to what's it like to be on the front line in Lancashire Care at the moment. So I'm now still within my first 100 days in post. A massive thank you to everybody for the very warm welcome that I've received. I've been delighted to come to Lancashire and really am excited about the future. We have got some significant challenges, as I'm sure lots of you are aware of, and I'm going to talk about some of them in a moment. But I'm really optimistic about the attitudes and the really positive feedback I've had from people about their excitement for the things we can do together going forward. So today, this technology has not enabled me to get this through in a live way from you, but I'm hoping going forward that this will be live and that you will then be able to have a little bit of a chat with Caroline and send in questions that you've got. So here's hoping that the next time that we have a chat with Caroline, that it will be live. So what are the things that have been taking my time up? I'm going to particularly talk about now the last few weeks, whereas next time I'll be talking about the last couple of weeks, more or less. So one of our big challenges that lots of people that I've met have talked to me about is the culture. And the culture is one that we need to get to be much more engaged than we have now. We need to make sure that the way that we're leading the trust is inspiring people. We need to make sure that we've got really good feedback mechanisms. We need to make sure that we've got openness and transparency. And we need to make sure that we're rapidly learning. And we're learning from the feedback on our front line, particularly from our clinicians, but from everybody who works in Lancashire Care. So we've been, in the last few weeks, focusing on our plans for listening into action. I'm absolutely delighted last week, and those of you that are on Twitter will have seen the tweets, that Amy and Laura have been appointed, both nurses who are going to be our LIA clinical leads. And in the next couple of weeks, we're interviewing consultant psychiatrists who are going to join the team as well. During July, so next week, the pulse check for listening into action is going to go live. So I'd really appreciate it if you could just take a few minutes out. It's only 15 questions. It's going to ask you what's it like to work at Lancashire Care. It's also going to ask you what are your 2 or 3 real priorities that you'd like us to be focusing on early days. Now, a big part of our journey needs to be a journey about, for the future, improvement. And the way we're going to improve is, of course, about the culture, and part of that culture needs to be that we look outside and see how we can learn, as well as make sure that we're learning lessons inside the trust. So we've already developed a partnership with Northumberland Tyne and Wear. We're delighted to have our Director of Ops, who's come from NTW. And this week we've been over to Combined Healthcare in Staffordshire and had a team probably of about 40 clinicians who've been across and had a look at what's the sharing and the learning we can take from there. So thank you to everybody who was part of that, and please continue to develop those networks and make the improvements. In terms of our clinical priorities, we have very many, but our absolute top priorities at the moment, as a lot of you will be aware of, are our adult mental health services. So we've had the NTW review, we've now got the action plan that we're working on. One of the highest priorities for our adult mental health services is to identify locations where we can open some rehabilitation beds. This is something that we don't have for our service users in Lancashire and something we really need. We're also investing significantly at the moment in our community teams and our home treatment teams and our liaison teams in the hospitals. So thank you to everybody, and you can all play your part in encouraging people that you may know that don't work in the trust to come and work in the trust, talk about this new journey that we're on, and that it can be and will be a great place to work. So, as well as adult mental health, learning disability is a real priority for us. We have no commissioned learning disability beds in Lancashire, and as a result of that, we have far too many people in Lancashire with a learning disability who are having to receive care and support in a bed outside of Lancashire. So again, we're urgently looking at where we can have some beds that could be opened. At the moment, we're looking at potentially the Blackburn site and what the opportunities are there. And we're also looking at how we can have an enhanced intensive support team, similar to a home treatment team that we have for adults, for people with a learning disability. Now, we also, as a priority, are focusing on how we're working together with our partners in the health economies. So we've got the ICPs that are developed across Lancashire, and I know that lots of you in our community services, as well as our learning disability and mental health services and children's services, are all working with partners at the moment. We had a board development session yesterday, a whole day we took out to really think through what is the future direction of travel. It's the start of many days together, and I'm really keen that we start to hear your views around the future direction of travel for our trust. We talked about the priority to make sure that our services are working alongside the new ICPs in the different geographies, and we need to start to discuss what does that mean for the way we run our services and how we structure and lead our services. We've got an Engage event for our senior leaders coming up in a couple of weeks. And we've also got a variety of different professional forums where we're going to be having discussions. And we're also going to be using the Listening into Action new processes to get your feedback about that. We've also had a really busy time in the last few weeks, and the last day today is our CQC Well-Led Review. I've got my interview this morning with the CQC. I want to say an enormous thank you to everybody who've been part of that preparation and the great feedback generally we've had from the CQC about our staff and our leaders. I know that some of you are working in very difficult circumstances, but in spite of that, you've managed to talk optimistically and positively about the plans that you have and the services that you are delivering. So thank you to everybody. A couple more things that I'm just going to update you about. On the national strategy perspective, one of the things that the plans have been going on nationally and are progressing locally are something called new care models. And this is where our specialist services, so whether it's our secure services, our specialist CAM services or eating disorders services, for example, are currently paid for by our specialist commissioners on a regional basis. So the new care models is aiming to see how can that money be devolved down to much more local spending and much more local plans, and so that we can develop local services for local people. So we're right in the middle of developing our proposals for new care models with a whole variety of partners at the moment. So again, thank you to everybody who's been doing that. And then my final really important issue I just wanted to touch on is the importance of us really welcoming our staff from Cumbria. So lots of work in the last few weeks has been taking place to work in partnership with our staff in South Cumbria. Lots of meetings, lots of clinical discussions. Tomorrow, myself and some of the board are going up to the Cumbria board to talk about this. And again, a really big thank you, because the feedback I've had informally from the staff and clinicians in Cumbria is they are starting to feel really included and really welcomed. And the conversations we've had to date have been really positive. So that's just an overview of the things I've been working on. Now, the other thing that I really wanted this to focus on, this little chat with myself, is to answer some of your questions. And some of you have already written into us about the queries and questions that you have. So we have 4 questions that at the moment you've asked me to answer. I'm hoping as we go forward that'll build, and I'm hoping that by doing this live going forward it'll be a bit more interactive as well. But if I can just give you the headlines and the questions and talk to you about some of the answers, what we will do is make sure that there is absolute clarity and we put these openly on our website. So the first is somebody has written in who is a nurse and who is retiring after 35 years as a registered mental health nurse and hasn't been afforded the opportunity of returning. So this for me is an absolute no-brainer. It's so essential. We are only going to be as good as a trust as our wonderful staff, and we need our staff, we need to retain our staff, and we need to encourage people to have flexible working lives and to return when they retire if they choose to. So I'll absolutely be taking this up and finding out why we aren't doing more and making sure going forward that we will be doing much more in terms of retire and return. So the other issue that this nurse has flagged to me is the fact that she didn't have an exit interview, and she would really have liked to have had that. And again, this is something that's really important. If we're going to create a culture where we're learning lessons and improving, then we need to hear feedback from people. So again, that's something that I will be picking up. We had some time yesterday at the board to really think about our people and culture strategy going forward. So both these things can be contributing into that. So thank you very much for that. Really important question. So the second question, again, essential, I think, and very insightful, was again from a nurse who said how difficult it was reading the NTW report, something that I completely can relate to. And I've been delighted that all the conversations I've had following the NTW report, that staff haven't been defensive and are absolutely up for the improvement we can make together. And one of the key issues that came up through the report was one around our culture of risk. And this nurse has said how difficult it is, the risk-averse culture that we have, and she couldn't agree more with that. And what are my thoughts as to what we can do for the future? So again, with the learning from NTW and from Combined Healthcare, where we've been this week, and Richard Morgan as our medical director with the consultant body, and Paul Lumsden as our nurse director with the wider clinical body, are really starting to think through how can we start to change the culture. Now, the feedback I've had particularly is that we have too much of, it's a perception of a blame culture, and people have had some difficult experiences in inquests and coroners. So we need to, and we will be very much going forward, supporting our clinicians to make sure they've got the right frameworks for practice, the right policy, the right guidelines, but where they're working within those, that we completely support them to take clinical risk. We heard a lot this week from Combined Healthcare clinicians who talked about new models of care that they developed for people with a personality disorder, where the evidence base for treating people in inpatient units is not very high, and how they had to work through taking more risk. And that's something that will be of the highest priority for us. We're also looking through Richard Morgan externally to other clinicians who can come to help and to tell their stories. So it'll be one of the high priorities for us going forward. Next question, and again, really important one, was my previous trust smoke-free? And if so, how could I share how we achieved that? So we did a lot of work on smoking and supporting people to stop smoking and becoming a smoke-free organisation. Really important that we support our staff and our service users and carers to look after their well-being, and obviously support people who are smoking to stop where they feel they want to. Now, in my previous trust, we ended up calling this Towards Smoke-Free because we did a whole array of things, and it took us probably about 18 months to prepare people. But we ended up having vapour still, and hence why we called the strategy Towards Smoke-Free. We had to do lots of work with service users, with carers, and that went on. And we only heard this week about how they're going back at the moment. And initially there was an increase in incidents, but now through the support that was put in, there was a significant reduction. So this is something that is really important for us going forward. I don't quite understand yet what our work that we've done around smoke-free is. I'm sure there's more for us to do. So I'll be looking forward to getting support for that going forward. And the final question that we've been asked is around our responsibility in terms of recycling. And do we recycle non-confidential paper, and could we start to look at, could we have alternatives to medical wipes that could be recyclable? Again, really important issues. So the first is that we do recycle non-confidential paper. I've checked that out, so thank you for raising that. And secondly, on the medical wipes, apparently it's a little bit too difficult to have recyclable. Two reasons. One is the lotions that are put onto the wipes that impregnate them, it means that they can't be recyclable. And secondly, because of the nature of what medical wipes are used for, they are categorised as clinical waste, so have to be completely destroyed. So really great questions. Thank you to everybody, and please keep them coming in, and I will talk to you in a couple of weeks or so time. Thanks very much.